An FDA panel is expected to begin a two-day discussion on booster shots Thursday. Moderna and Johnson & Johnson's vaccines are both on the agenda. And on Wednesday, the agency released a review of J&J's shot, suggesting a second dose may in fact boost antibodies. Meanwhile, Dr. Anthony Fauci is answering a frequently asked question about the pandemic. What's the end game? He says it's to get control of the virus. Coronavirus infections have been falling in the U.S. recently. The nation is averaging about 86,000 daily cases. But as Meg Oliver shows us, some hospitals are still overwhelmed.
Hillary, your mama's up there.
On the other side of this door is Pam Lee's 35-year-old daughter, Hillary, who's fighting for her life.
You're not alone.
The restaurant manager was planning to get the vaccine when she got COVID at the end of September. Within 2 weeks, she was on a ventilator.
I was a nurse for over 40 years, and so I knew this could happen. I was praying it never would, but here we are.
How does her prognosis look?
I can't even go there. She's only alive because of this machine.
Can you wave to your mama?
As Hillary struggles to communicate.
I love you too.
Downstairs in the emergency room,
Let's give me a good deep breath.
Dr. Jamie Belsky is trying to keep up with the crush of new COVID patients.
Just keep a scalpel in my pocket in case we have an emergency airway. We're getting to where if we don't see an improvement in the number of patients soon, we're going to have to start looking at, do we need to ration care?
The ICU at Billings Clinic is operating at 175% capacity.
How do you get more people vaccinated to stop this?
Talk to your friends, talk to your family, explain to them, yeah, it's getting better in some parts of the United States, but it's getting worse here.
Leaving families like the Lees praying for a miracle.
When you look at her, what do you think?
I can't even think. It's just painful to watch. And these things can be prevented.
Dr. Carlos Roberto Jaén joins me now. He's a professor of family and community medicine at the University of Texas Health San Antonio. Welcome, Dr. Jaén. So, Dr. Anthony Fauci says that it will be difficult to eliminate this highly transmissible virus, COVID-19, in the foreseeable future. Explain what that means we are likely to face in the years to come.
So elimination is really not something that we can aspire to. We have other viruses that are similar, like the influenza and other viruses. So the goal is not elimination, but control. We need to get more people vaccinated. We need to be able to get a better handle on how people get protected. And only when we do that, we can really talk about control. Elimination is not going to be possible as long as there are pockets of the virus all over the world. But I think we need to continue our efforts to improve, use the things that work, masking, vaccines, and make sure that everyone who is eligible for vaccination uses it.
Well, when you're talking about control, part of that might also mean that we, even the vaccinated population, have to have regular booster shots. So I want to ask you about that because the FDA has released its review of Johnson & Johnson's request for booster shot authorization. Tell our audience what were the major takeaways and how that's going to play into the FDA advisory panel's meeting later this week.
Well, it's hard to predict exactly where they're going to land, but the data that they've released show that there is, particularly for Johnson & Johnson, a benefit for having a second booster. And there's also data that was released related to using others to amplify the effect or the protective effect that we're seeing. So it's very likely that the boosters are coming, but at this point, they're not approved for general population, but only for people who are over 65 and those who are at risk of contracting the virus during their work.
I also want to ask you about this new study by the NIH, because it found that actually mixing and matching coronavirus boosters might not just be safe and effective. In some cases, it actually appeared to trigger a greater immune response. Help us all understand the significance of this.
So Pfizer and Moderna are messenger RNA vaccines, and they use different technology from J&J. That study that was released that is not quite yet reviewed is showing that by using a different vaccine, the effect on the immunity is improved significantly. And it may actually be higher if you use a messenger RNA such as Moderna or Pfizer. But it's difficult to know at this point. It's a very small study. But the main point that I think is important to emphasize is that vaccines remain highly effective and safe, particularly for severe disease or for disease that is likely to for prevention of hospitalization and deaths. So the big point here is to get your friends and anyone who is eligible vaccinated as a way of protecting ourselves and our communities.
Well, part of that question about eligibility is going to be coming up very soon because the White House says that it's preparing for children ages 5 to 11 to receive the vaccine. The FDA, as you know, will be meeting later this month to discuss Pfizer's vaccine for this age group. What can we expect once those shots start rolling out?
I think that this is a great opportunity for primary care to provide the vaccinations that are commonly given to children and given in the setting of primary care offices. The plan from the White House includes the distribution of vaccines in ways that are effective, and they are much more commonly used for children. So in that sense, I think it's very hopeful. I also saw the information that perhaps as early as November, kids 5 to 11 may be vaccinated, may be approved for vaccination for them. The dose is a little different, but I think it's important to emphasize that by going through primary care, you'll be able to also reach populations that up to this point have been less vaccinated in terms of communities that are dying at a higher rates than others.
Well, we are also now 2 months into the school year, and according to the head of the CDC, more than 95% of schools are open full-time. But some experts are still warning of a possible difficult winter ahead, battling both the flu and the coronavirus. So how do we keep schools open and kids safe?
The first step is to surround them with adults and those who are eligible being vaccinated. It's important also to have schools with policies that implement full coverage or use of masking, universal masking in schools. It's also important for kids to be vaccinated against the influenza virus. That's going to be real. That's available for all ages. And I think that the damage that may come from closing schools is bigger than the importance of keeping them open. Our kids have already suffered too much by being away from school, but we need to have environments where everyone above 2 years old is masked, even in schools, even in daycare centers, but also anyone who is around them needs to be vaccinated. And we need to encourage all their parents, all their relatives, and all the workers around them to do that.